Did you know that neglecting just one small daily habit can double the risk of erectile dysfunction after age 60 without the man even realizing it? I'm Dr. James, a men's health specialist with over 30 years of experience treating thousands of older male patients. Over the course of my career, I've witnessed countless men gradually lose sensitivity, control, and confidence. Not because of serious illness, but because they were never taught how to properly care for one of the most important parts of their body, the penis. Many men think that caring for their private area is only about sexuality. But in reality, how you care for this organ directly impacts blood circulation, sleep quality, and your overall sense of vitality and control, all of which are key to male health after 60. In today's discussion, I'll share 4 essential yet surprisingly simple principles for maintaining sexual health in men over 60. These are not expensive or complicated solutions. They're practical habits you can begin today. And if you stay with me until the end, I'll reveal 2 lesser-known habits that might just be the missing piece to sustaining long-term vitality and performance. But first, if you believe this topic is important, don't forget to subscribe to Advice for the Elderly so you never miss a crucial tip on senior health. Keep the penis functioning or risk losing it. As a urologist, I've met many men in their 60s and beyond who complain about losing sensitivity or energy down there. What's troubling is that most of these declines aren't purely due to aging. They happen simply because of disuse. Just like any organ in the body, the penis needs exercise to maintain its function. When sexual activity declines, or when there's no stimulation at all for long periods, blood flow to the area diminishes. This causes the tissue to become undernourished. Smooth muscle fibers begin to atrophy, elasticity decreases, and sensory nerves weaken. This condition is known as disuse atrophy. And yes, it can happen to the penis too. Even more concerning is that many older men don't realize this. They accept their declining function as an inevitable part of aging, not knowing that just a bit of intentional care and regular blood flow stimulation can help preserve erection quality, sensitivity, and confidence with their partner. Now, keeping the penis active doesn't mean you have to maintain a youthful sex life. Sometimes gentle stimulation or using a medical-grade vacuum erection device to encourage blood flow is enough to keep the tissue healthy and prevent fibrosis. Remember this, the penis is not just a symbol of masculinity, it is a living part of your body, and with proper attention, it can remain your loyal partner well into your later years. Proper hygiene, it's not just about cleanliness, it's about long-term health protection. In over 30 years of working with older men, I've realized that many have never been properly guided on how to care for their genital area. And the consequences of this lack of knowledge can be serious. Caring for the penis isn't simply about keeping it clean. After the age of 60, skin becomes thinner, immunity weakens, and the body's ability to heal slows down. Careless hygiene habits, or worse, completely neglecting this area, can create ideal conditions for bacterial or fungal infections. Small red spots, mild itching, or slight burning sensations may quickly progress into chronic inflammation, balanitis, or even, in some severe cases, penile cancer. I once treated a 72-year-old patient named Walter who came in complaining of mild discomfort when urinating. He assumed it was just an effect of aging. After examination and lab tests, we discovered he had chronic balanitis caused by poor hygiene, which led to long-term irritation and damage to the skin cells. The most striking part? This condition was entirely preventable. That's why I always advise my patients, wash the genital area daily with warm water and a mild fragrance-free soap, such as glycerin-based soap. If you haven't been circumcised, gently retract the foreskin to clean underneath, but do so carefully to avoid tearing or damaging the tissue. After washing, pat the area dry thoroughly. Excess moisture provides the perfect environment for yeast and bacteria to thrive. Especially after sexual activity, cleaning the area is essential to prevent inflammation due to pH differences between male and female genitalia. Proper hygiene isn't just about disease prevention. It's an act of respect toward your own body. And when you know you're clean and healthy, you enter every interaction, even intimate ones, with much greater confidence and peace of mind. Never have sex before full erection. It can prevent serious injury. This is one of the most common mistakes men over 60 make, often without even realizing it, until the consequences begin to quietly show. I've seen many patients come into my clinic reporting symptoms like a slight curvature of the penis during erection, pain during sex, or a loss of control and flexibility in intimate situations. Upon further examination, most of these cases shared one thing in common. Sexual activity was attempted before achieving a full erection. Why is this dangerous? When the penis is only partially erect, the inner tissues have not been fully engorged with blood. At this stage, applying strong pressure, like during penetration, can cause micro-injuries, tiny, unseen tears. Over time, these accumulate and form scar tissue inside the corpora cavernosa, leading to a condition known as Peyronie's disease, characterized by an abnormal curve of the penis, painful erections, and in some cases, severe difficulties with sexual intercourse. I recall one patient in particular, Harold, 68, a physically fit former athlete. After several instances of sexual activity when not fully aroused, he began to notice a leftward bend in his erection, along with tightness and mild pain. He was eventually diagnosed with early-stage Peyronie's, a condition that could have been prevented had he known to listen to his body and avoid rushing. So how can you prevent this? The answer is simple. Slow down. Give your body enough time to become naturally ready, both physically and emotionally. If necessary, use a lubricant to reduce friction and prevent tissue damage. Most importantly, communicate openly with your partner. Mutual understanding, empathy, and a shared rhythm are the keys to safe, meaningful, and deeply satisfying intimacy after age 60. Limit porn consumption to rebuild genuine connection. This is a sensitive topic, but one that's essential in the journey of maintaining sexual health after 60. As a specialist physician, I've witnessed many older male patients gradually lose their real emotional connection and desire toward their partner, even when physically healthy. The cause isn't always aging, but often stems from a seemingly harmless habit. Watching pornography regularly, it's understandable why many men turn to adult content. It's simple, private, and doesn't require the effort of communication or emotional engagement. But over time, this habit can disrupt the brain's natural arousal system. When your mind is constantly stimulated by intense, unrealistic, and easily accessible images, it begins to treat those stimuli as the new baseline. And suddenly, real-life touch, real emotions, and even genuine affection start to feel not enough. I once treated Richard, 66, a man who used to enjoy a deeply fulfilling sex life with his wife. After retiring, becoming more sedentary, and turning to adult videos in his free time, he started to experience erectile difficulties, emotional numbness with his spouse, and growing guilt. He wasn't addicted, nor did he watch excessively, just frequently enough to affect his nervous system. This doesn't mean you have to give it up entirely, but if you find yourself feeling disconnected from real intimacy, try cutting back. Focus instead on rebuilding genuine closeness, a longer hug, an open conversation, or simply touching one another with full emotional presence. No rushing, no need for perfection. At this stage of life, sensitivity, emotional connection, and authenticity are your most precious resources. Don't let digital illusions rob you of the real human moments that are still yours to enjoy. Change your sleeping habits to protect sexual health. It might seem trivial, but the position you sleep in and the type of underwear you wear at night can significantly impact the health of your penis after age 60. Surprised? In over 30 years as a urologist, I've seen numerous cases of silent, long-term damage, all traced back to improper nighttime habits. Many older men continue sleeping in tight underwear, especially briefs that snugly press against the groin and penis. While this may not cause immediate discomfort, over time it contributes to various issues, from impaired blood flow and soft tissue compression to chronic irritation and even Peyronie's disease, abnormal penile curvature. Why? Because during sleep, even older men experience nocturnal erections, a natural and essential physiological process that maintains blood flow, nourishes penile tissue, and keeps sexual function intact. But if the penis is compressed, bent, or restricted by tight clothing, especially when sleeping on your side or curled up, these natural erections can be disrupted, causing repeated, unnoticed trauma. I once treated Larry, a 72-year-old who had worn tight briefs to bed for 50 years without ever questioning it. When he came in complaining of tension and slight curvature in his penis, imaging revealed the beginning of fibrous plaque formation. Thankfully, with timely intervention and lifestyle adjustments, surgery was avoided and his condition was brought under control. My advice? Let your body breathe at night. If going fully nude feels uncomfortable, switch to loose-fitting pajama pants made of soft, breathable fabric. Or ideally, sleep without underwear altogether. It may seem like a small change, but it's a deeply loving and respectful act toward your body. You'll sleep better, feel more relaxed, and most importantly, silently protect a vital part of your sexual well-being. A new lifestyle is the true root of male sexual health. After 60, I often tell my patients something that may sound simple, but holds the power to transform their lives. You cannot have good sexual health if your lifestyle is working against your own body. Everything happening in your body, blood circulation, hormone production, nerve response, and even emotions, is directly influenced by how you live each day. This is especially true after age 60, when the body becomes more sensitive to environmental, behavioral, and emotional factors. The penis is a vascular organ, which is why erectile dysfunction is often the first warning sign of cardiovascular issues. If the arteries supplying the penis become narrowed or hardened, erectile function will decline, often before any other symptoms of heart disease appear. I've treated countless older men who believed that medication alone would solve their problems. But what truly restored their vitality was not a pill. It was changing how they lived. Just 20 to 30 minutes of walking each day, eating cleaner, sleeping well, managing stress, and cutting out harmful habits like smoking or heavy drinking can gradually shift the body's balance. Testosterone levels naturally improve, blood flow increases, your mood lifts, and the penis, as a core indicator of male health, responds directly. You don't have to be perfect. You just have to be consistent. Choose a plate of leafy greens over fried food. Go for a walk instead of sitting in front of the TV for hours. Swap that glass of hard liquor for a night of deep sleep. I've seen men in their 70s and 80s regain a sense of agency and confidence, simply by changing how they lived each day. And I believe you can too. If you've made it this far, I want to thank you sincerely, because it takes courage for a man over 60 to look honestly at his sexual health, and even more courage to open up to himself about something many assume is past its time. But as I often remind my patients, your body hasn't lost its ability to thrive. It's simply waiting for you to reignite it. Caring for your penis after 60 isn't just about maintaining sexual function. It's about preserving blood circulation, nervous system health, muscular strength, confidence, and a deep sense of self-agency. It's how you tell your body, I'm still here. I still care about you. From keeping it active and clean, avoiding hidden sources of injury, to adopting a healthier lifestyle, every small action adds up to a stronger, more fulfilling life. You don't have to do everything at once. Start small. A short walk, a better sleeping habit, a healthier meal, a moment of listening to your body instead of ignoring it. Aging may bring wrinkles, but it doesn't take away your desire to live fully. And you, more than anyone, deserve that.